everyone, welcome to the channel. Today we'll discuss an interesting MCQ. Nobody knows what happened overnight. Keep watching for more information. Here is the grand MCQ. A 70-year-old man is admitted having woken up at 8 am with a new hemiplegia of his right arm and leg. He was last seen well by his wife at 11 pm the previous night. He has a history of high cholesterol but is not compliant with his medication. He smokes 20 cigarettes per day. A CT brain scan shows an acute left middle cerebral artery infarct. His blood pressure is 145 by 100. We asked about what is the most important next step in his management. Option A, rapid transfer to local neurology stroke center for urgent thrombolysis. B, clopidogrel 300 mg for 7 days. C, aspirin 300 mg for 14 days. D, ivalabitol aiming for a mean arterial pressure less than 90. E, discussion with a local neurosurgical center. Okay, so if you are new to my channel, please pause the video for a few seconds and try to identify the main keywords here. From the main keywords, try to come to your own diagnosis. So that's the way that this video is becoming useful to you. And my regular viewers, you know how we do it. First, we identify the main keywords. And then by analyzing the keywords, we try to exclude answers one by one and come to an ultimate diagnosis. So what are the main keywords here? Actually, this MCQ is a really good one and it's full of hints. So here is our pinky keywords. He is a 70-year-old man woken up at 8 am with a new hemiplegia of his right arm and leg. Last seen well by his wife at 11 pm. Please do pay attention to this time frame. It's really important to our management option. High cholesterol but not compliant with his medication. He smokes 20 cigarettes per day and there are two risk factors. CT brain scan shows an acute left middle cerebral artery infarct. This word is also very important. Blood pressure is 140 by 100. We asked about most important next step in his management. And as I told you earlier, it's full of hints which are very useful and it's a very classical history and it's not really a difficult one, but you should know your facts well. Using these useful hints, you can exclude answers one by one and come to a correct answer. Okay, you may be wondering why there's a clock. This clock I put to emphasize the importance of time frame. Here, he was last seen well by his wife at 11 pm and woken up in the morning at 8 am. So, how many hours between these two incidents? 1, 2, 3, 4, 5, 6, 7, 8. Almost 8 hours gone. So, incident has happened in between within this time frame. So, that's why I put an alarm clock so that you will remember when you face another MCQ like this, the importance of time frame. This CT image is just for your knowledge. It shows a large middle cerebral artery infarction. Please keep in mind that it's really significant when infarction affects the anterior circulation. And also remember that middle cerebral artery infarctions are most common than other areas. In our MCQ, now we have a clear diagnosis. It's an acute stroke and also CT has excluded primary intracerebral hemorrhage, and then all people presenting with acute stroke who have had a diagnosis of primary intracerebral hemorrhage excluded by brain imaging should as soon as possible should be given aspirin 300 mg orally if they are not dysphagic or aspirin 300 mg rectally or by enteral tube if they are dysphagic. So this is the most important first step in the management. Thereafter, aspirin 300 mg should be continued until 2 weeks or 14 days after the onset of stroke symptoms, at which time definitive long-term antithrombotic treatment should be initiated. People being discharged before 2 weeks can be started on long-term treatment earlier. And also keep in mind that clopidogrel is used for secondary prevention after acute management of stroke. And if the patient is allergic or is intolerant of aspirin, that means having like gastric irritation, gastritis like symptoms, you can prescribe clopidogrel or dipyridamole. And keep in mind that heparin is not routinely indicated here. Since we are told about the blood pressure control in this MCQ, a little bit about blood pressure control. Antihypertensive treatment in people with acute stroke is recommended only if there is a hypertensive emergency with one or more of these features. That means with hypertensive encephalopathy, hypertensive nephropathy, hypertensive cardiac failure or myocardial infarction, aortic dissection, preeclampsia or eclampsia only. And blood pressure reduction to 185 by 110 or lower should be considered in people who are candidates for thrombolysis. In other people, there is no urgent blood pressure reduction within 24 to 48 hours period of time. Keep it in your mind also. And I want to emphasize a little bit about decompressive hemicraniotomy in ischemic stroke, like in this case scenario. In patients with large space occupying infarction, the subsequent edema complicated by transtentorial herniation poses a lethal threat, and this occurs particularly in patients with malignant middle cerebral artery infarction. In malignant middle cerebral artery infarction, there is a high mortality, and brain swelling secondary to the vessel occlusion is associated with high mortality. So the patients with large hemispheric infarction may suffer from increasing intracranial pressure resulting in cerebral herniation and subsequent mechanical and ischemic damage of healthy cerebral territories. And also, just for your information, in like 1 to 10% of all patients with acute middle cerebral artery occlusion, the subsequent ischemic stroke can be classified as malignant, defined by ischemic brain tissue large enough to cause considerable increase of intracranial pressure and potential cerebral herniation. Decompressive craniectomy in this scenario has a significant proportion of the skull is surgically removed, and it allows the ischemic tissue to shift through the surgical defect rather than to the unaffected regions of the brain. Therefore, it avoids secondary damage due to increased intracranial pressure. It's a very important point, and just keep it in your mind also. Now, with all this information, let's go back to our MCQ. Here, the time difference is more than 8 hours. So, if the time of onset can be defined, then urgent thrombolysis is indicated within a period of 4.5 hours. The last time this patient was seen well was at 11 p.m. and the onset of symptoms could have occurred any time between then and when he was found. And also some trials are ongoing to determine whether thrombolysis can be safely given in patients who wake up with symptoms of a stroke in whom time of onset cannot be determined. For the answer A is not correct. We can't do urgent thrombolysis since it's past 4.5 hours. So answer A is excluded. Clopidogrel 300 mg for 7 days. No, it's strong. We discussed it earlier. IV Levitral aiming for a mean arterial pressure less than 90. No, blood pressure should not be reduced acutely in the first 24 to 48 hours. And we discussed earlier the criteria for acute blood pressure reduction before. So this answer is also excluded. Discussion with the local neurosurgical center. This is to carry out a neurosurgery, preferably decompressive hemicraniectomy as we discussed before. But since we asked about the most important next step, this is not the next step. So this answer is also excluded. And adding a little bit, decompressive hemicraniectomy can be carried out if there is reduced consciousness and signs on CT of an infarct of at least 50% of the middle cerebral artery territory. So if these features are there, we can proceed to decompressive hemicraniectomy later after given initial treatment with aspirin 300 mg. And our correct answer is C, aspirin 300 mg for 14 days. Keep in mind that we can only give aspirin 300 mg after excluding hemorrhagic stroke. Now to your take-home message. Keep in mind that urgent thrombolysis can be carried out only within 4.5 hour period, and as the initial step, we should give aspirin 300 mg for 14 days followed by clopidogrel 75 mg. Blood pressure should not be reduced acutely in the first 24 to 48 hours, and we discussed about the criteria for lowering blood pressure before. So other aspects of management are prevention of complications, secondary prevention of risk factors, and rehabilitation. This is just a revision guide to refresh your knowledge. Please do read around your guidelines, your NICE guidelines and other subject matter you read. I hope this MCQ is useful to you. If it's useful, please do subscribe my YouTube channel for more videos like this, and let's meet from another important MCQ like this.